بسم الله الرحمن الرحيم. أنا دكتورة ماجدة الناظر. I will give you a lecture about Phylum Platyhelminthes. Phylum Platyhelminthes means the helminthes or الديدان المفلطحة. This lecture will intend to ILOs بتاعتنا هي to have a general idea about trematodes, study intestinal trematodes which are present in the human intestine. Also study the trematodes of biliary tract which are usually called liver flukes. Trematodes are called so because they look like the tree leaves. As we see, they are pointed from the anterior and posterior part and flattened dorsoventrally and wide in the middle. They are parasites of vertebrates, mostly hermaphrodite, meaning that they have the male and female genital system at the same time. All have complex life cycle needing more than one host, and there is the phenomena called alternation of generations, which means that every stage is totally different than the other stage in its life habits and its shape. Their larval stages develop in snail hosts, ending in the cercaria, which are aquatic, while the adult stages live in man and animals. Now we have to know about the characters of trematodes. Most trematodes have leaf-like bilaterally symmetrical body. The body is covered with tegument, which is the covering membrane and not acute solid cuticle, which shares in active absorption of nutrients and active transport of excreta. They have two attachment organs, the oral and ventral suckers. The oral sucker usually functions also in feeding because it helps to suck the food matter inside the worm, while the ventral sucker is merely attached to the wall of the lumen or to the wall of the viscus, fixing the worm from movement anywhere. The digestive system begins with muscular esophagus behind the oral sucker. Sometimes there is a pharynx which branches into two intestinal ceca. They are called ceca because they are blind in the posterior end, and the worm usually regurgitates the food leftovers and also the excrements. They are regurgitated through the mouth cavity after digestion. Genital system consists of two testes leading to the genital pore, a single ovary which is connected to vitellaria, then leads to a uterus which opens also in the genital pore, in the same genital pore of the worm. Eggs are oval with smooth, transparent shell. Most eggs have operculum. They are operculate, and this operculum is a covering end where the miracidium escapes from the egg, but sometimes they have spines instead of operculum. The miracidium, which is the larval stage coming out of the egg, is covered with cilia because it swims in water and penetrates the snail host. It transforms into sporocyst. Sporocyst produces the next stage, which is called redia. This gives birth to redia 2, and redia 2 gives birth to cercaria, and usually it always forms cercariae as long as it is alive, which come out from the snail and swim by their tail in the water. They call cercaria, circus means tail, so they are tailed creatures which swim by their tail in the water. They are very tiny, maybe they reach about 400 micromillimeter or less. Some cercariae secrete acetone and develop into encysted metacercaria, while others are infective, penetrating the host skin. This is the shape of miracidium and the cilia around. This lump is germinal cells which form the organs afterwards. This is the sporocyst containing several redia inside. This is the redia, which has what we call here, it has something we call birth pore, which is the pore through which escapes the daughter redia. And finally, this is the cercaria. The cercaria has an oral sucker here. This is the oral sucker. Here is a ventral sucker, and this is the tail end which swims, which helps in swimming. And around here there are the germinal cells which form the organs later. This is a collective diagram for life cycles of many worms. Fasciolopsis boscae, which is an intestinal trematode. Paragonimus westermani, which is a lung trematode or lung fluke. And Clonorchis sinensis, which is a liver fluke. We have here the first one, the intestinal fluke, comes, the infection, it comes out in feces as eggs. The eggs give miracidium in the water. Miracidium goes to the snail. Then the cercaria insists around the herbs here, insists around the herbs here, and man eats the infected herbs to complete the life cycle. Concerning the lung fluke, we'll see that here is the miracidium, then the egg, sorry, this is the miracidium, somewhat rounded. It goes to the snail, and the cercaria comes out. The cercaria has a small tail, a very small tail or knob-like tail. It insists on crabs and water creatures which are eaten by the patient to come and settle in the lungs of the patient. The third one, the liver fluke, we have here, this is the egg of Clonorchis, then comes out the miracidium. The miracidium here is inside the snail intermediate host, and the cercaria comes out. The cercaria has a membranous tail, then it goes to insist inside fish. When man eats raw fish or undercooked fish, he gets the infection and the worm settles in the biliary tract of his liver. First, we'll begin with intestinal flukes, which are the trematodes of human intestine. The first one is Fasciolopsis boscae. Fasciolopsis boscae is a giant intestinal fluke at the صباع كده تقريبا. It is present in India, China, Taiwan, and Southeast Asia, means that it is a trematode of the Far East. The adult worm lives in the small intestine. Heavy infection may spread to the whole intestinal tract, meaning it's covering also the colon, and lifespan is 6 months, means that from the beginning of infection till the death of the worm, it takes 6 months. Concerning morphology and life cycle, infection occurs by ingestion of encysted metacercaria in water or on freshwater plants, which are eaten fresh and draw from the water directly. Reservoir hosts are also some herbivorous animals like pigs, dogs, and rabbits. Encysted metacercaria, when eaten, is liberated in the duodenum, attaches itself to the intestinal wall by the suckers, and grows into adult, which produces eggs within 2 months, meaning from the beginning of infection till the infection becomes patent and eggs come out of the patient, it takes about 2 months. The adult worm measures about 2 to 7.5 centimeter long and 1 to 2 centimeter wide، يعني زي ما قلنا قد الصباع تقريبا. This is the adult worm. Here is the oral sucker. This is the oral sucker. This is the ventral sucker. This is one of intestinal ceca. The vitelline glands are around in the periphery, and here are the testes, this one and this one, and this is the ovary, and this is the uterus going to the genital pore here. the eggs are unembryonated when passed, means that they have one cell stage embryo. They are large, brownish, measuring about 140 by 80 micromillimeter. This is a big worm, so the eggs are also big. The eggs need about 5 to 7 days to mature inside the water, and the miracidium comes out the operculum and invades the intermediate host, which is snail of Clonorchis or Gyrolus families. The larval stages are sporocyst, regia 1, regia 2, and simple-tailed or leptocircus cercaria, which passes out to insist in water or on plants. This is the egg, and here is the thin operculum, and this is the life cycle of Fasciolopsis boscae. Here we'll see that the habitat is the small intestine, but we say that it covers the whole intestinal tract if the infection is heavy. There are the adults in small intestine, eggs coming out in water, and embryonated eggs in water in 1 week. Then the miracidia goes to the snail, cercaria comes out, and it is infecting patient through the plants. Also, the pigs are the reservoir hosts and also other herbivorous animals. Pathogenesis and symptoms. طيب دودة كبيرة زي دي ممكن تعمل ايه؟ أول حاجة الاتاتشمنت اوف لارج سكر اللي هو تقريبا بيبقى 2 ل 4 ملم in diameter to the intestinal mucosa causes local inflammation, ulceration, and sometimes hemorrhage if the infection is heavy. The moderate to low numbered infections may pass unnoticed in healthy individuals, but the heavy infection is always symptomatizing. In heavy infection, the irritation caused by the worm can cause diarrhea similar to giardiasis, with bloating and with offensive odor and with malabsorption and sometimes vitamin B12 deficiency. The large number of worms may also cause intestinal obstruction sometimes. Generalized edema and ascites develop in heavy chronic infection. They were thought to be due to absorbed worm toxins, but it is due to hypoalbuminemia from malabsorption and protein wasting enteropathy, which occurs due to the chronic diarrhea caused by the worm. There is also nutritional anemia and marked eosinophilia. Diagnosis is easy by stool examination, finding the eggs. Sometimes the worms in itself are expelled with diarrhea. Also, when we use purgatives, we can find the others. Treatment is praziquantel, which is the drug of choice, and with the usual dose given for any other trematodes. Also, we can give niclosamide, which is given in the morning on empty stomach, and the tablets are chewed thoroughly. Now, a very small worm is introducing itself, which is the heterophytes. The heterophytes are two types of worms. One of them is present in Egypt and the other is present in Far East. These are two minute flukes, Heterophis and Metagonymous yukagawai. From the name, Metagonymous yukagawai means that it is a Far East trematode. Also, Heterophis is present in Far East, but it is reported from Egypt and Palestine and Lebanon. Metagonymous is also reported from Spain, Balkans, and Russia. Balkans means جزر البلقان اللي هي يعني تعتبر يوغوسلافيا وتشيكوسلوفاكيا والجماعة دول دي كلها جزر البلقان. The parasites live attached to the intestinal villi. The reservoir hosts are fish-eating mammals like dogs, cats, sometimes other animals which can eat fish. Morphology and life cycle. Adults are tiny, very, very small. They are almost microscopic with 2 to 2.5 millimeter by 0.4 to 0.7 millimeter. Heterophis has a spiny genital sucker, but Metagonymous doesn't have this genital sucker. Infection occurs by ingestion of raw, undercooked, or undersalted freshwater fish of many kinds, which contains the infective encysted metacercaria. In Egypt, it is present in two types of fish, mugel, which is البوري زي ما بنقول عليه, and tilapia, which is البلطي. The eggs are deposited in feces with mature miracidium, but they don't hatch in water. They are swallowed by the snake. The eggs are deposited with mature miracidium. They are operculate, thick, small, 27 by 15 micromillimeter. They are eaten by the snail intermediate host, which is Pyrenella conica, then develop into sporocyst Regia 1, Regia 2, and the membranous tail cercaria or Lophocercus cercaria. عامل زي الورقة. The cercaria penetrates into the muscles of fish and insist and stay till next infection. This is the life cycle of Heterophis. I chose this diagram because they have here and here patients look like Arab patients, واحد بالطربوش والتاني لابس عمامة أهو. This is the adult Heterophis. Note that this one is the genital sucker, and this is the ventral sucker, and this is the oral sucker here. This is the egg, which is operculated, thick-walled egg, and this is the snail. The snail doesn't look like freshwater snails. It looks like the salty water snails because it is present in brackish water, which is a mixture of fresh and salty water. This is the place where Heterophyid is endemic. This is the Cercaria. These are the types of fish which are the intermediate hosts of Heterophyid. This is the Balti, and this is the Buri or tilapia and mughal fishes. Here is the encysted metacercaria inside the muscles of fish. Man eats fish, as we see, undercooked or undersalted, and gets the infection. This is the adult Heterophyid, as we see under the microscope, and here is the genital sucker. This one is the genital sucker. This is the uterus full of eggs, and here are the pair of testes, and this is the ovary. This is the egg of Heterophyid. We have here the operculum. This is Metagonymous Yokogawai. In Metagonymous, we can notice that there is no genital sucker, and the genital pore here doesn't have any sucker around. And here are the two testes and the ovary. Now we come to the pathogenesis and symptoms of Heterophyid infection. There is light and moderate infections are asymptomatic, as we agreed before. In heavy infections, it causes inflammatory changes in the mucosa with chronic intermittent diarrhea, vague abdominal pain, nausea, flatulence, wasting, as in malabsorption syndrome. Adults sometimes penetrate mucosa or their eggs are pumped there by the genital sucker, which is the dangerous part in Heterophyid infection. These eggs form emboli inside the circulation. They go to be lodged in parenchymatous organs like heart and brain, causing ischemic heart disease or causing brain affection, focal brain affection according to their site of lodgement. There are seizures، يعني هيبقى فيه بالنسبة للنيورولوجيكال manifestations هيبقى فيه تشنجات، seizures, neurologic deficits or neurologic symptoms according to the place of lodgement. Also, there is cardiac insufficiency leading to heart failure. This is a cross-section in the intestine with a cross-section through the worm itself. Here we can see that the intestinal mucosa is having a mucus proliferation of goblet cells, and also there is thinning of the mucosa here because of the inflammatory and the pressure of the worm, the inflammatory effect and the pressure of the worm itself. Here we can see that this part is the part of the oral sucker. Here is, and this one, they are the intestinal ceca of the worm, and these dark colored objects are some eggs in the uterus. Diagnosis is easy by finding the characteristic eggs in feces. The eggs can be easily found in feces because they look like dark aggregations in the mucus diarrhea, which means like that they are like black pepper, or that if زي ما يكون حد مثلا رشش فلفل اسود على الستول اللي موجود, which is transparent due to excessive mucus, so we can pick out these dark spots and examine them, and we find the eggs. Treatment is praziquantel in the same regimen for other flukes. Also, we can give tetrachloroethylene, which is taken in the morning on empty stomach and drinking only water after intake for 3 years. Now we come to liver flukes. Liver flukes will have one in the Far East and one in Egypt also. They are parasites of biliary passages. The worms induce hyperplastic inflammatory changes in bile channels with surrounding fibrosis. Massive infection thus can cause portal cirrhosis and also the complications of portal cirrhosis as we see in other liver disease. The eggs of Clonorchis are like those of Heterophyid, while the eggs of Fasciola, the other type of liver flukes, are similar to Fasciolopsis. Differentiation is only by endoscopy and bile sampling. The first one we'll study is Clonorchis sinensis. Sinensis means that it is in China, and so it is the Chinese liver fluke, or the Far East type or Far East infection of liver flukes. The infection occurs in China, Japan, Korea, and Vietnam. كل البلاد دي بتاكل السمك ني تقريبا في السوشي وفي الأذر meals with fish, so they get the infection very easily. Habitat is in the smaller bile passages near the liver capsule, but they may reach to the gallbladder and pancreatic duct in heavy infection. لما الدنيا تتملي في البريفري يزحفوا على السنتر شوية بشوية لغاية ما ممكن يوصلوا للجول بلادر أو عن طريق الكومن بايل داكت يملوها ويروحوا كمان للبنكرياس أو البنكرياتيك داكت. Dogs and cats, fish-eating mammals, are important reservoir hosts. بالنسبة للمورفولوجي واللايف سايكل بتاعتها احنا خدنا فكرة قبل كده بس برضو نركز عليها تاني. الادلت measures about 1 to 2.5 by 0.3 to 0.5 centimeter, means that it is of moderate size. It is characterized by the testes being branched and posterior, and the vitellaria and uterus are in the middle area of the body. Infection occurs by consumption of raw, undercooked, pickled, and smoked freshwater fish containing metacercaria. وزي ما قلنا عن طريق الأكلات أو الوجبات بتاعتهم كلها السمك تقريبا ما بيستويش فيها، فعشان كده الانفكشن سهل جدا إنها تحصل، ويحصل ري انفكشن تاني كل ما ياكلوا infected fish. Metacercaria are liberated in the duodenum, the same as in Fasciolopsis, and they pass to the liver via the ampulla of water to bile duct, then to the smaller bile ducts to settle and grow to adults. This takes about 1 to 1.5 months to occur, and the eggs, when deposited in water, they are engulfed by the snail, the same as in Heterophyid, and the larval stages occur in the snail, ending in membranous tail cercaria, which insists in fish for the next infection. This is the life cycle of Clonorchis sinensis. See here, the egg looks like that of Heterophyid and also the cercaria. It insists in muscles of fish, and this causes the infection. Here is the adult Clonorchis sinensis with the branched testes in the posterior half of the body. This is the ovary. Here is the branched testis. Here is the ovary. And here is the uterus, which is convoluted and ends in the genital pore here. This is the egg, which is similar to that of Heterophyid. This is the membranous tail cercaria. It looks like this is the tail, but we can notice the striations of the membranous part of the tail here. أنا بحدده لكم تقريبا كده علشان نقدر نشوفه. هو بياخد حوالي تلتين the length of the tail، بيبقى membranous بالطريقة دي، أو بيبقى فيه membrane بالطريقة دي، عشان كده بنقول عليها لوفو سيركس سيركاري. Pathogenesis of Clonorchis sinensis هنلاقي إن برضو light and mild infections are asymptomatic. In heavy infection, there is thickening, dilatation of bile ducts accompanied by mucosal gland hyperplasia, because of the irritation of the worm and its excreta. Chronic infection and biliary hyperplasia leads to adenocarcinoma or cholangiocarcinoma in the bile ducts, and so it can cause cancer in the liver. Here is a cross-section of a chronically infected patient. This is a worm, and this is another worm. We can see here the cross sections in the uterus. This is the mucosa. You see also, if we enlarge the picture, we could see that there is hyperplasia of mucosa. The submucosa, as we see here, is very thick, and also there is fibrous changes here or excessive fibrosis around the bile duct, and this is the liver tissue here. Symptoms in heavy infections: there is fever, cholangitis, diarrhea, epigastric pain, anorexia due to cholangitis also. There is enlarged tender liver, and sometimes there is jaundice. Eosinophilia is high and may be accompanied with leukocytosis due to secondary infection of the bile canaliculi. Within a month, symptoms disappear and the eggs begin to be present in stools. Repeated infections or chronic infection may increase worm number, and patients complain of biliary obstruction, gallstone formation, and other sequelae of chronic cholangitis. Also, cirrhosis may occur, but is more due to malnourishment rather than the infection itself. Diagnosis: by recovery of eggs from feces, duodenal aspirates or string test is recommended to confirm that the infection is by Clonorchis, not Heterophyid, because they are the same, and the eggs are the same, and they are present in the same locality. Treatment is by praziquantel, which is the drug of choice. Now we come to Fasciola hepatica. Fasciola hepatica is a common liver fluke infection in our country, and also it is present in many Arabic and European and American countries. It is a common parasite of herbivores and has cosmopolitan distribution. Human infections are common and heavy in endemic areas where there is animal raising grounds. It inhabits the large bile passages and the gall. Morphology and life cycle. The adults measure about 3 centimeter by 1.5 centimeter. Cephalic cone is a conical part in the anterior body, and it is anterior to the ventral sucker. And other features are similar to Fasciolopsis bascae. They have dark periphery and central area is pale. Also, they are flattened dorsoventrally and symmetrical. This is a group of Fasciola worms. This one is Japanese strain, which is broad, like we see. This long one is American type. This moderate sized one is the Egyptian and Sudanese type or North African type. This one is the European type, and I think this one also is a European type. This is the worm on the slide. This is a colored diagram for the worm. Here is the ventral sucker. Here is the oral sucker, and this part shows the branched intestinal ceca. This is the vitelline glands, and testes are present here. Uterus is the dark convoluted one, and the ovary is present here in this area. Infection occurs by swallowing encysted metacercaria with vegetables or drinking water, same as Fasciolopsis. Metacercaria in the duodenum penetrate the duodenal wall. They migrate on the omentum, then enter the liver by burrowing through Glisson's capsule and liver tissue till they reach the bile ducts. So they can cause damage of the liver tissue while migration. In their way, they may not reach the liver, and thus they form ectopic foci or abscesses because they die anywhere else and in the peritoneum or elsewhere in the abdominal wall. The eggs, after a while, are passed with bile to appear in stools. They are similar to Fasciolopsis bascae eggs, being operculated 140 by 75 micromillimeter, but they have bile stain. They are golden yellow. This is the life cycle of Fasciola hepatica. This is the natural host, which is sheep or cattle, and man here is considered an accidental host because it is not the natural host of the disease, but it could infect man at the same as in animals. The egg is immature, matures in water, gives miracidia, then the snail host. This is a slide showing the eggs of Fasciola. They are golden yellow. Here is the operculum. This is the miracidia with 2 eye spots and some germinal cells here. This is the redia of Fasciola. This is the cercaria of Fasciola, simple tail. And Finally, the encysted metacercaria on the grass, and this is the snail host of Fasciola, which is called limnia. Pathogenesis of Fasciola. Human infection gives rise to mild symptoms during migration of juveniles to the liver. In bile ducts, the large worms produce both mechanical and toxic effects. This causes hyperplasia of bile ducts with surrounding fibrosis and partial or total biliary obstruction. The usual issue in case of fasciolasis that some patients are complaining of prolonged fever with eosinophilia and pain in the upper right hypochondrium, and they are positive for fasciola antigen detection. So if they take the treatment, we find that they subside, the case subsides, and they get better. This is a case of early fasciolasis. Or the second type is an acute case with acute biliary obstruction and very severe colic. After operation, they can find that the cause of biliary obstruction is an adult fasciola worm. Secondary bacterial infection may occur during penetration of the metacercaria into the liver, and heavy infection usually ends in portal cirrhosis. Concerning symptoms, biliary obstruction and cholangitis are the main symptoms. There is leukocytosis and eosinophilia from early infection. The large flukes can be seen by sonography in early stages of the disease. Also, a pharyngeal form of the disease can occur, which is called halzoon. This occurs in the Middle East from eating raw animal liver. Usually in Sudan and in Lebanon, they are used to eat the raw liver because they think that it is more rich in vitamins and minerals than the food one. They only cut it into pieces and swallow it or eat it raw with lemon and some pickles. This can also have, they also can have some parts of the worm. The suckers of the worm can stick to the pharynx and cause a very severe acute pharyngitis, which we call halzoon. Diagnosis: endemic areas is suggestive. Finding the eggs by stool examination, duodenal intubation, or string test. Also, ultrasonography can reveal flukes in bile ducts. Concerning treatment, we have triclopyrdazole, which is used in veterinary treatment and is recommended now for humans, even in children. The second drug is nitazoxanide. This drug is given for other parasitic infections, intestinal parasites, but it is found to be effective in case of fasciolasis. It is given orally, and the dose for adults is 500 milligrams twice daily for 7 days. Bithionol orally every other day for 10 to 15 doses. This drug is toxic and it is not the drug of choice for fasciolasis. The last is praziquantel, which is not effective in case of fasciolasis. Fasciola gigantica, the giant liver fluke. This one is more present in Egypt and North Africa and in America. It is larger than Fasciola hepatica, about 5 to 7 centimeter length, has a more attenuated form, يعني مش عريضة زي دوكا, elongate. It has less prominent cephalic papilla or cephalic cone, and it has highly branched intestinal ceca and larger ventral sac. It infects cattle, camels, water buffalo in Africa and Orient, but introduced to other parts of the world with export and import of the cattle and buffaloes. Human infection is considered accidental, meaning that it is an animal infection mainly. It occurs in endemic areas with fasciola. The life cycle pathogenicity and clinical picture is similar to Fasciola hepatica, and now this ends our lecture. Thanks for listening and good luck.